Welcome to our final session. We'll wait until we get probably at least 50, 60 people to join the room, and then we'll go ahead and get started. So a few more moments and then we'll get started. If you have questions ahead and you'd like to get started putting those in the chat, feel free to do that. Hi, everyone. Welcome. We'll get started in a moment or two. It's good to see so many familiar names rejoining the session. Hi, everyone. Thank you for joining. We will get started in another moment. Just give everyone else a chance to log on before we get started. Hi, everyone. Thank you for joining us today. We do have a great presentation this morning. Dr. Ruben Basker and Sydney McMaster will be presenting today. I have about 2 after, so we'll go ahead and get started since we're planning to record. So if we can just go ahead and get started with our routine regular slides. Again, this session is being recorded. The slides and recording will be sent to everyone who has registered for the session. And if you do have a question during the session, please be sure to use the question and answer button at the bottom of the screen. We'll get to as many questions as possible, and I believe there will be plenty of time for questions today. Also, please be sure to fill out the survey after today's presentation. All of your feedback is extremely helpful to us. And feel free to go ahead and customize your responses in some of those open-ended places, because again, your feedback is important to us. We'll just go ahead and point out some of the features to the Q&A slides. So if I could have the next slide, please. Great. To view all of your questions or just your own question, look at all questions. You can comment on questions if you choose to do that. And feel free to go ahead and upvote a question if you have an interest in that question as well, because that helps us to prioritize the questions and responses. And if you want to submit a new question, go ahead and go ahead and do that. Use that new submit feature. Next slide. I'll just give you a quick view of the research analytics branch of the NIH library. We offer several services, all data related. We offer a bibliometrics service if you like to find out the impact of your research or perhaps your group's research. We support that with both bibliometrics and altmetrics. We also offer bioinformatics support. We offer lots of software packages at our public workstation, as well as many training classes for bioinformatics. And then data services. We will help you with your data management plans or finding resources for data or finding a place to use, to store your data management plan. We also help with coding for visualization, analysis, statistical support, and coding training. Um, okay, I've already pointed out the bioinformatics tools. If you have additional questions, you can visit our website or you can email me directly. I'm happy to help. Just to highlight a few of our classes, if you, next slide, please. Um, we do have the following R classes and data management classes coming up in May. So again, I encourage you to visit our website and register for any of the classes that interest you. So with that library promotion out of the way, I'd like to go ahead and introduce our speakers today. First, we have Dr. Ruben Basker. Dr. Basker is the program officer and the research engagement officer and outreach branch chief within the NIH All of Us research program. He's excited to be working with the team and helps maintain essential and community partners. Prior to his current research program as an technology policy fellowship. Health policy began during his graduate of disease and signal transduction. Very important. Dr. Besk,
Cindy,
yes.
I'm sorry, you're breaking up quite a bit through Ruben's intro. Could you try turning your camera off and starting again?
Oh. So can you introduction again? Could you advise me as to whether you can? Oh, uh-oh. Thank you.
We might be able to hear you.
Okay. So stop me if it is choppy, and we'll figure. Both Dr. Basker and Sydney McMasters have important backgrounds I want to cover. So anyway, I was saying that Dr. Basker is the program officer and research engagement and outreach branch chief within the NIH All of Us research program engagement team. He is excited to be working with the team that helps maintain the essential relationship between the program, participants, and community partners. Prior to his current position, Dr. Basker began working with the All of Us research team as part of the American Association for Advancement of Science, AAAS Science and Technology Policy Fellowship. His interest in health policy began during his graduate work at Vanderbilt, where in addition to researching mechanisms of disease and signal transduction, he gained an appreciation for the effect of policy on human health. Dr. Basker received his doctorate in clinical and cellular biology from Vanderbilt University and his bachelor's degree in biology from Washington University in St. Louis. After Dr. Basker speaks, Sydney McMasters will be also presenting to us today. She is passionate about health equity, a strong advocate for health equity, and has served as a program officer and research engagement specialist for the NIH All of Us research program for over 2 years. In this role, she functions as a liaison between the researcher community and the national program, offering support and technical assistance to researchers interested in studying the program's data set. Prior to this role, Sydney served as a public health analyst within the Health Resources and Service Administration for 3 years, and as a previous participant in a Pathways internship with HRSA. Sydney is passionate about supporting equitable pathways for diverse professional interests in research and public health careers. And I'm very, very pleased to introduce both of them. And Dr. Basker, without further ado, I'll let you take it away.
Yes, thank you, Cindy, for that fantastic introduction, and especially for the parts that you may have said twice. So it's always nice to hear all your past as many times as it takes. But thank you so much for that great introduction. And yes, so I'm Ruben Vasker. I'm the Researcher Engagement and Outreach Branch Director for the Division of Engagement and Outreach at the All of Us Research Program. And I'm very excited to be speaking with all of you today, and I'll give you an overview of what we'll be covering. So first, today we'd really like to go over a pretty substantial amount of information, but really our focus really boils down to two main things. One, we'd like to share resources for researchers interested in using the All of Us data set. Hopefully that's many of you who are joining us today. And then also we'd like to reserve some time near the end so we can hear directly from you as to what resources you need, any questions that you have about these resources, or any questions you have about the All of Us Research Program or the data set specifically. But before we go into all of that, let's see how we got here. So as Cindy had noted, this is actually a webinar series, and this is the final webinar in a series of 5. And for those of you who have joined us for all 5, thank you so much. Happy to be closing things out on what I think will be a great presentation. And if you're just joining, don't worry, you'll be able to view some of the recordings of previous webinars if you weren't able to attend them or if you didn't know about them. And the links to the previous sessions will be sent out after this call. And over the course of this series, we've provided an introduction of the All of Us Research Program, the Research Hub, the All of Us Researcher Workbench, how to register for it, how to dive into the Researcher Workbench data, which is the mechanism by which you can actually access the All of Us data set. And then finally, some introduction into coding in the Researcher Workbench itself. And hopefully all of these previous sessions have whetted your appetite to use the data set. And what that means is you might run into difficulties along the way. And so today's session will really be focused around resources that can help you regardless of what you're encountering. Hopefully there's a resource that's able to facilitate your work. We'd really like to function as the NIH library does as research partners in your work. And so one of our main focuses for today will really be providing an overview of the right resources at the right time, depending upon where you are in your research journey. Now, we'll be covering hopefully a fair bit today, but don't worry, we'll be sharing the slides after this call, as Cindy said. So first, who are we? So in addition to the NIH library, we also have the Data Research Center, who facilitates a lot of work with researchers using the All of Us data set, but also the researcher engagement and outreach efforts within the program are based within the Division of Engagement and Outreach. And so we'll give a brief overview of what this division is, what its focus is, different things like that. And then we'll go into the types of activities connected to the program overall. And before you can talk about the Researcher Engagement and Outreach branch, you have to talk about the Division of Engagement and Outreach for the All of Us Research Program. And this division is organized into 4 branches focused around community and participant engagement, tribal engagement, operations and disseminations, which kind of connects all the branches, and then finally, researcher engagement. And while the focus for each of these branches is different, the foundational approaches of each of them is really the same. It's really based around engagement, building trust, building bidirectional relationships. And each branch works within an all of us engagement ecosystem and an all of us researcher engagement ecosystem. And this is what that looks like. It's made up of outreach leaders, participants, engagement awardees, and these are groups that will use a variety of programs and strategies to engage with community members and researchers. And all of their work has really contributed to the very large and growing researcher community using the All of Us data set currently. And recently the program celebrated the milestone of 10,000 registered researchers on the researcher workbench. So this is a very big community right now, and hopefully we'll be able to add some of the members of this call to it as well. Now, the partners on this slide have a host of support programs and opportunities for one of the crucial priority audiences for this researcher engagement ecosystem, and that's researchers like yourselves. And so if you've been really interested with this series, you might be considering conducting research within the All of Us data set. And so to provide an overview of what that might look like, I'd like to share a researcher's journey within the researcher engagement ecosystem. And over the next few slides, you'll learn about some of the resources available at each of the steps within this journey. And I'll stress this point here. It all looks nice and neat on this slide, but any research effort never really ran smoothly. And so really, if your journey doesn't look like this, don't be too concerned. Really, the goal of this slide and the goal of sharing this journey is really to provide a series of just signposts, guideposts, really to give you an idea of resources that are available at each step. So don't be too concerned if it doesn't follow exactly this path. So starting out, let's start with data access. So the first 3 steps of the journey are really concerned with how to access the All of Us data set. And this was actually covered within webinars 1 through 3 of this series, so I'll go somewhat quickly through these. But generally, the first 3 steps are confirming first that you have institutional access to be able to access the data. Next, creating an account and verifying your identity. And after that, completing some required training and signing a data user code of conduct. So starting, an interested researcher should first confirm that their institution has a current data use and registration agreement with the program. For intramural researchers, this will likely be your IC, and you'll be able to check this with some of the resources on this slide. So there is an institutional agreements webpage. It lists all of the institutions that have active DURAs, and it has a search bar. So one of the first steps you'll take is first seeing if you are within an institution that has an active data use agreement. Now, if you are, great, we can move on to the next step. If not, there are some resources to support you in actually submitting a request to create a DURA. There's an infographic and one pager that kind of outlines this process that's shown in the slide on the right, and that can be shared with institutional administrators to really help set some expectations about what the DURA process entails and a timeline associated with it as well. So there's also, if you run into any problems, a specific email address connected to supporting troubleshooting for DURAs specifically, and that's aou-dura-support@bumc.org. Now, after you've kind of confirmed that you've had institutional access, you can move on to account verification, account creation and verifying your identity. This slide goes into some of the mechanisms that you might use to do that, either login.gov or id.me. Some of the differences between these tools are shown on this slide. If you have kind of additional questions about identity verification, there's a number of articles related to this at the User Support Hub. There's actually links within this slide that will go to those specific articles as well. So if you have any issues with that, hopefully having the slides afterwards will be able to support you there as well. Now, the next step after you have verified your identity is completing required training and signing a data user code of conduct. Now, a copy of what this user code of conduct looks like is actually available within the User Support Hub as well. And after you have created this account and you've signed this data user code of conduct, you'll complete a responsible conduct and research training, and you'll also learn about a few different policies related to using the program's data set, a data and statistics dissemination policy, a publication and presentations policy, and really the importance of protecting participant information. So with all of these steps complete, and again, some of this was covered in earlier webinars, I'll hand things over to my fantastic colleague, Cindy McMaster, who really has led a lot of our collaborations with the NIH Library for this series. And I think in many ways, crucial to this presentation that we're giving today. So Cindy, please, if you'll talk about some of the next steps, I think that'd be great.
Awesome. Thank you, Ruben. And hello, everyone. Good morning, good afternoon, wherever you may be. As Ruben said, I'm Sydney. I help support the Researcher Engagement and Outreach branch. And I got a notification saying my connection is unstable. Can you confirm that you can hear me okay?
Yes, we can hear you just fine.
Okay, thank you. All right, Ruben, let's advance the slides, please. Okay, so now that you're familiar with the steps it requires to access the Workbench, the following slides are going to be going over diving into the resources for working with the data within the Researcher Workbench. And within the journey, this includes steps 4 and 5. Next slide, please. Thank you. So before forming a research question or designing your inclusion or exclusion criteria of your research cohort, it can be helpful to explore all of the various resources, including research that's currently underway by other researchers. So what you can see here on the screen is called the Research Projects Directory. This is a publicly available resource that shows all of the research projects within the Researcher Workbench. It includes project descriptions provided by other researchers upon registering for the Workbench. And you can also see a user support hub on the screen. I'll cover this in subsequent slides, but this also includes live training sessions for more tailored or project-specific support. And on the next slide, you will see the All of Us Researchers Convention. So if you prefer a different format other than reading research project descriptions on the website, then you can watch recordings from the 2024 Researchers Convention, which occurred exactly 1 month ago today. This is the program's largest gathering of researchers who present their research findings and network through various sessions throughout the 2-day event. This year, we had over 1,700 registrants, which included researchers, program participants, and the broader research community. And this provides a great example of the types of research being done, in addition to the types of researchers that are using the data set. This ranges from high school students to established investigators, and it's a really inspiring and invigorating event. So I highly suggest that you check out the recordings if you haven't already. So you've watched the convention recordings or attended the live event, and you have an idea of a research topic question that you want to investigate. So you're ready to get started. But where exactly do you start? So I first recommend checking out the User Support Hub. This is another publicly available online resource that's organized by articles and topic areas and training videos. And you'll see a landing page, which is shown here on the slide, and there's a Getting Started button. So that's a really good place to get started. And if you have questions, it is likely somebody already asked it, or it's somewhere on the User Support Hub. And this is also a great resource if you'd like to learn independently or asynchronously. And in our experience working directly with researchers, the best way to learn the Workbench is truly to just jump into it and start exploring it. And don't be afraid or intimidated to play around with the features within the Workbench. However, if you're reading support articles or you're watching asynchronous videos and that's not really working for you, then there are a variety of live sessions that you can attend. You can see here some pictures of previous live sessions hosted by the program partners in 2023. And if you would prefer to have some support from experienced researchers or subject matter experts, over the next few slides, I'll share some current offerings coming up in the next coming months for registered researchers. And I highly suggest completing the registration process for the Workbench before registering for these sessions, as most of these are limited to only registered researchers. And this is because the facilitators will be referencing internal aspects of the Workbench that are only available to registered researchers. On the next slide, you will see a snapshot of what types of recurring events are available within the typical month. So over the next few slides, you'll see this calendar in the top right corner of the slides that are highlighting the specific sessions described on each respective slide. There's also a live event calendar located in the User Support Hub that's also linked on the slide here. So we'll start with the first type of live offering, which is called New User Orientations. And these are shown here on the left in yellow. These are typically offered the first Friday of each month, and they're a great introduction for new users or those who need a refresher. After attending new user orientations, I recommend exploring the All of Us Evenings with Genetics Workbench support sessions. This is out of Baylor College of Medicine, one of our funded researcher engagement partners. And this covers rotating topics on a monthly basis that are shown here in green. These are offered every Wednesday and follow a topic rotation, starting with introduction to the workbench, creating a cohort data set, introduction to workspace buckets, and then they round out the month with issues common to beginners. Once you're oriented to the workbench, you can bring questions to the DRC or the Data and Research Center's drop-in office hours. These are hosted weekly on Tuesdays, and they're shown here in orange on the left. This is a great opportunity for registered researchers to get their questions answered in real time by experts on the researcher workbench. And if Tuesdays from 2 to 3 don't work for you, then you have another opportunity to connect with the DRC on Fridays at the same time, shown here in pink. The Friday sessions are offered every other Friday and are focused on specific topics. But depending on the size of the audience that joins, you might have an opportunity to ask a project-specific question or a question unrelated to the topic being covered that day. And users of any level of experience are encouraged to join these sessions, so don't feel like you need to be an expert to join. In addition to the regularly scheduled offers, there's also topic-specific sessions hosted sporadically throughout the year. So on the slide here, you'll see that I've included some workshops beyond navigating the workbench. This includes how to use All of Us data in grant applications, or the ethical, legal, and social implications of genetic research for all of us. Okay, so you've explored the resources, you've attended live sessions, and you're feeling a little bit more comfortable with using the workbench. So at this stage of the research process, many researchers find the data dictionary to be one of their most utilized resources. This contains a description of each data field and which data are suppressed within the researcher workbench or the control tier, or I'm sorry, the registered tier or the control tier. And on the website, this is linked under the data methods section shown here. And finally, if you're interested in learning more about coding or programming languages and the different environments that are available within the researcher workbench, then you can find resources in the user support hub on RStudio and SAS Studio, both of which were recently added and covered in some previous webinar sessions, in addition to information on Jupyter Notebooks. And another plug for the NIH library, I know they have some sessions coming up on Jupyter Notebooks, so highly recommend registering for those as well. Alrighty, so now we will finish out the researcher journey with knowledge mobilization. And in other words, this is publishing or presenting and sharing your findings. So it's helpful to be aware of the expectations and the program policies before preparing an abstract, a presentation, or a publication. So the checklist shown here on the left is a great resource to ensure your research is following all program policies before you share your findings. You might be wondering, okay, but where do I share my findings? In the past, the program has had a large presence at a variety of conferences throughout the United States. Here, I've highlighted the American Society of Human Genetics, the American Public Health Association Conference, and the annual Biomedical Research Conference for Minoritized Sciences. But there's others that the program has attended and researchers have attended as well. Researchers from all career stages present their findings as research posters, through oral presentations, or moderated sessions, or roundtable discussions. And as a program, we really make an effort to visit and connect with the researchers presenting on All of Us data at conferences. So if you decide to present an abstract using All of Us data, please let us know by completing the All of Us publication and presentation reporting form. And in addition to conferences and in-person events, researchers can share their research through other formats in the program. These formats include Voices of All of Us, or research spotlights, and researcher testimonial videos. All of these highlight personal experiences and perspectives of researchers and are a really great opportunity to share your research findings to a wider audience, including program participants and the general public. And finally, the last resource I will share is a curated list of funding opportunities that All of Us data and tools are responsive to. This list is updated regularly, so I recommend checking this frequently if you're interested in applying for funding. And now I will hand it back over to Ruben to give us a sneak peek of what's to come next year.
All right, thank you so much. It's, I think, a fantastic overview and a great way to complete our series. So hopefully we have a number of members of our audience who are headed to some of these live events. They really are a fantastic resource, and I really hope you take advantage of them. So now that we've shared some resources that are available to you right now, you may also want to be planning ahead. And that's especially if you are considering future research aims for your projects, grants that you'd like to submit to, different things like this. So now I'll share some future-facing resources, starting with the program's data roadmap. Now, if your data type of interest is currently not available, I have good news. The program plans to release new data types to researchers over time. And the data roadmap really provides a snapshot into the different data types that are expected to come out from the program in the future. And if you want to stay very up to date with everything new with the program, new data types, new tools that are available, anything new that's going on, I really encourage you to sign up for the program's Research Roundup. This is a bi-monthly Research Roundup newsletter. And another fantastic way to stay updated with the program is to review the growing number of publications that have already used the All of Us data set. So the program's mission is to accelerate health research and medical breakthroughs, enabling individualized prevention, treatment, and care for all of us. And none of that's possible without researchers sharing their findings through publications and, as Cindy talked about, knowledge mobilization. And there are over 400 publications that are currently making use of the All of Us data set, and over 700 citations to one of the original publications, the 2019 All of Us marker paper, really demonstrating the growing scientific impact of this data set. And yes, these slides will be available after the presentation. So if you didn't focus your phone fast enough for that specific QR code, don't worry, it will be available to you. And with that, I'd like to move into some thank yous, not just for this session, but some of the entire session series, starting with the most important thank yous. First, really is a thank you to our participants who, in a literal way, have donated a piece of themselves to make all of this possible. And I'd also like to thank all of you in attendance, and of course, the NIH Library, who's been an amazing partner in this series. And I really had no doubts about that. I have a soft spot in my heart for librarians, for libraries. Libraries have always been a favorite place of mine. And really, one of the things that I like to do when going to any library is to walk in and get a little lost, take maybe a few turns into aisles that maybe haven't been visited in a while, and kind of take a book off of a dusty shelf and open it, brush some of that dust off, because there's something uniquely sad about a dusty book. Books call out to be read, not just sit on a shelf, but really to be understood, to help improve life, anyone's life. And I think the All of Us data set really calls out in the same way. It calls out to do good in the world. And my hope is that some of you on this call will answer that call. So with that, I'll thank you again for listening. And if you'd like to get in touch with our division or learn more about it, you can email us or read our annual report. And if you'd like to learn more about the program, you can do so at allofus.nih.gov. And if you'd like to explore the data, you can do so at researchallofus.org. And I'll now open things up for questions. But before I do, one last note of appreciation for our hosts, the NIH Library. Their vision statement is trusted service, faster insight, better health, to which I will add for all of us. So with that, are there any questions?
We did have one, and I see Danielle's typing an answer as we speak. I'll read it off to you, Ruben, and then we can also open the floor to Danielle or Sam if they have anything to add. So it says, including Python, RStudio, and SAS Studio in the Workbench is really helpful for allowing analysts true flexibility for applying state-of-the-art methods, especially within these new data types being released. So is there a way to conduct simulation studies? And I missed the question there. Let me go back here. That mimic AOU data, scales, and structures without incurring preliminary cloud computing costs against the initial credits given to new users? Or will any compute incur decrements in our cloud credits? And Danielle responded, because analysis takes place on Google Cloud Platform, all analysis are associated with costs. These costs go towards storage and computing power. Ruben, anything to add on your end, or Sam, anything to add from you?
So yes, actually. So I think if you're kind of new to the cloud computing environment, there are some resources throughout the NIH that might be helpful to you. One of them that I'll kind of make a note here for actually exists within the Office of Data Science Strategy, and that's the NIH Cloud Lab. And that really allows users to get some cloud experience and gain some familiarity with cloud computing before actively moving into, say, using the data set itself. So that's the note that I'll kind of give a resource, from another area within the NIH. But Danielle or Sam, if you'd like to share some other resources as well, please do.
Ruben. Yes, that's a wonderful question. At this time, all cloud computing does cost money. So using the cohort builder and the dataset builder are free of charge, but once you spin up a virtual machine or cloud analysis environment, that does start to incur cost. Right now, the program doesn't have any way to do mimicry studies before getting into cloud computing cost, but it could be something we consider in the future.
Okay, it looks like there was one additional question, Sydney, which I think you responded to, but just in case you wanted to reiterate.
Yeah, we can cover it. So somebody asked, can we put the registration links for the live events in the chat? So I've added it to the answer in that Q&A. But you look at the slides, and the slides do have linked out links throughout every slide. So your browser might be a little overwhelmed because there's a lot of slides in there. But I do suggest clicking through the slides on your own time to really explore all of the resources that we covered today.
And they are great resources. Thank you so much for sharing them with all of us here at NIH, because it's great to see the information and understand, but there's nothing like getting your hands on and being in a live session when you're working with code and data and all of that. And I just want to reiterate what Ruben had said about data sets being very similar to a book. We used to say 20 years ago, wouldn't it be great to drill down into these data sets and look at the actual data? And we're here now. We can do this now. And it's really incredible. There was always a question of, can we really validate this? Well, now we can.
There's another question. It's asking about, well, first it acknowledges many thanks for clarifying the cloud compute credit cost model and pointing out the cloud lab. And then it says some researchers, such as an AIM ahead, may be accustomed to NIH covering cloud compute costs, such as done in NC3 or N3C. So Ruben or Sam, do you want to talk about NIH strides and potentially the AIM ahead collaboration if we have time?
Sure. I think Sam was kind of writing an answer. I'll give kind of a brief note, and hopefully if I've left anything out, Sam, feel free to also add in as well. First off, a note on cloud computing with the program. So every researcher will actually have an initial 300 credits, cloud computing credits, to use within their analysis. I'll state that for the majority of researchers, these amount of credits will actually cover most of the work that they will do. However, if you do have really kind of large data sets, something like high-powered genetic analysis, it might actually exceed that amount. So it's helpful to be aware of the type of research that you're doing, and also be aware that there is that initial 300 credits that's available to you. In addition, the program is very much has a connection to AIM ahead, which has which overlaps in many of its goals with the program itself, especially when it comes to supporting researchers who are underrepresented in the biomedical workforce. So much so, in fact, the program actually has an ongoing traineeship with AIMAHEAD, where one of our program partners, RTI, will actually facilitate training in the use of the All of Us data set for artificial intelligence and machine learning. This program is fairly new. It's actually in its inaugural year currently. It has 25 trainees that are actually trained in the use of the All of Us data set through the use of AI/ML. So really great to see other programs that have many of the similar aims as the All of Us research program connected to in this question. And yes, Sam or Danielle, if I left anything out, please let us know.
Yeah, thanks, Ruben. I do want to add just one thing. So cloud computing is related to Google Cloud Platform. And while the All of Us research program utilizes Google Cloud Platform, we are not responsible for the billing of that. And so what Ruben mentioned is that we do have many researchers who have NIH grants or programs that do cover costs. And the way that you can do that is establish an appropriate billing account in which that billing account is covered through a grant or whatever means that you have at your institution or program to cover cloud computing costs. And NIH Strides initiative does help with that. And so it's still a Google Cloud billing account. You will just work with your institution and your program to make sure that Google Cloud billing account is affiliated appropriately with an NIH award, or someone at your institution is covering that based on your partnership. And so we have a lot of resources on the User Support Hub. Also, one of my colleagues, Brandy Mapes, also went over billing in this NIH library series. So it might be useful to kind of go review that just so you can understand that ecosystem there. And then we're also here to help. Even within the Researcher Workbench, you can click set up a billing account with a third-party billing partner who is incredibly well-versed in NIH, grants, Strides. Our partner is Caresoft. And so you just tell them your needs and they will work with you and your institution to get that cost covered.
Yes, thank you so much for pointing out the Strides connection, Sam. And Cindy, I think you'd also mention this as well. Strides is really a fantastic resource. They've actually negotiated in many ways with some of these platforms to really offer some of the discounted rates when it comes to compute credits. So really, it's a resource that's available to NIH-funded scientists, researchers, and so really something that I encourage many of the members of this call to take advantage of, because it's available to you as an intramural researcher.
And I'll just add from kind of a peanut gallery perspective that what I've seen from when Sherry Shuley presented during the research festival, those costs are very minimal, you know, and the same during session 2. The cost. When I first came to NIH and I heard about computing charges and I heard, oh, charges, and I was thinking most investigators would be like, okay, well, once you say charges, I'm not interested because I don't have money on my budget for charges. But then when I saw the breakdown of charges, I'm like, they're very minimal and there are mechanisms for financing. And so even though there is this process there, it doesn't really impact the budget of the research itself is really my takeaway as a person from the peanut gallery. It's very minimal. The charges they're not racking up fast. It's not like cell phone charges or something like that. They're very minimal.
Yes, thank you for that note. And I think this, again, of course, any kind of charges, regardless of their amount, is, of course, of interest to researchers.
Yes.
And so there are kind of a number of different articles, as both Sam and Danielle have kind of shared about this, because this is a topic of great importance for many researchers as well. So hopefully you'll be able to take advantage of some of some of the FAQs that are around this, some of the resources that we've talked about before. And if your questions aren't answered, feel free also to reach out to the DRC support desk as well. And hopefully our DRC colleagues will be able to add in that link to that in the chat. There's also, I think, another question that's now currently being answered by Danielle. If you want to come off mute and answer that directly, I think you could.
Thanks, Ruben. I'm going to pass this to my colleague, Sam. Just wanted to answer it live.
That's a great question. Are there FAQs to help our institutional offices understand how to set up the cost coverage? So those user support hub articles are available. So anyone who sets up a Google Cloud Billing account can be yourself, or you can have someone at your institution who may be kind of the billing manager for your lab or your department, et cetera. They can set up the GCP account as well, or you can use the third-party billing partner and give them the appropriate information. And so all of that information is on the user support hub. But if you have specific questions related to your institution, please email us at support@researchallofus.org. Every institution does things just a little bit different. And so we can have some feedback and tweaks to help you make that process easy for you. Here, I've worked in labs groups where one lab manager is over all the funding. So to talk to that lab manager who may not be working directly on my project and explaining them, hey, this is how we set this up. This is what I need. So if you need help getting that requirements list, we'd be happy to help you.
All right, I think since, and happy to answer any questions that still come in. We have, I think, till the end of the hour, and happy to be a resource to all of you for as long as you're interested in asking questions. I think one of the things that we were also interested in the call was really asking what types of resources that all of you actually find helpful in research, either with the All of Us data set, if you've used some of the resources, if you've gone to some of the live sessions, if you've taken advantage of any of those and you have kind of notes about them, please let us know about that, things that worked well, things that we can change, that we always endeavor to have a continually improving workbench and a continually improving experience for researchers. Or if you have a resource in general that's been helpful for your research when it comes to data analysis, different things like this that you think is helpful to share as well. Happy to also make space for that. We do, so if you can put that, I think, in the chat, that's also helpful. But we also do have a question right now, which says, if you're in between school and a job at an institution, how do you set up a Google Cloud cost coverage as a citizen scientist? N3C covers this for researchers in this category. So I have certain responses to this when it comes to accessing the All of Us data set without an institutional data use agreement. I can kind of respond to that. I might turn it over to either Sam or Danielle to answer kind of the note on the cost coverage. But I'll say that in order to access the data set itself, you have to be connected to an institution that has DURA in place. So if you are moving between school and a specific job at an institution, as long as you have an institutional email, you'll be able to access an institutional email with an institution that has a data use agreement with the program. You'll be able to register and access the All of Us data set. If you're in between institutions, this is an interesting question. I also might request a response from our DRC colleagues around this.
So if you are, let's say, recently graduate or leaving a postgraduate institution looking for a job in another institution, but you would like to continue analysis for a specific reason, but you don't have grant funding or other funding, the only available option at this time is you could utilize something called Google Cloud Platform credits. They offer $300 for about 90 days, in which while you're in between a long-term billing solution, you could utilize their credits. We also have that on the User Support Hub. And then past that point, we don't really have any resources for funding. You can always look at the NIH page, which we advertise often for funding opportunities, but it typically does require that you have an affiliation with an appropriate institution to utilize it.
Any other questions? Feel free to drop them in the Q&A box. Or any questions from this entire series, feel free to drop them in there. Okay, I'm seeing no more questions. Well, Cindy, any final words from the NIH library side?
No, I'm not seeing any questions, but thank you so much for being here and providing this series. We will, if I receive anything, of course, I will forward that on to you. I see lots of opportunities for future partnerships because this is an incredible data set that I think is of great value to the intramural community. So thank you again for being here. Thank you again, as Ruben had said, to our audience for participating. Thank you for all of the Vanderbilt, all of us staff and NIH staff as well for being here to support this. And we want your feedback on the session. And thank you again. That it's been great working with you and all of us. So.
Yes, thank you so much. Really, in many ways, it's a little sad to be coming to the end of the series, but I will say it's been fantastic to share all this information with this great NIH library audience. I'd say if you haven't taken advantage of seeing the NIH library in person, please do. It's a nice, quiet space within the NIH campus, and I really thank you so much for attending. Thank you so much for all of your questions. And with that, please enjoy the rest of your Friday.
Okay, terrific. Thank you, everyone.
Thanks, everybody.